Have you always wanted to run but hip pain is stopping you? Hip pain is a common problem in runners, particularly due to the fact that a lot of force and impact goes directly through the joint and the surrounding musculature when running. It is estimated that the hip joint takes about 3 to 5 times a person's body weight with each running step, which when you think about it is a big load for one joint to handle. Hi there, I'm Liv from the Bod Squad in Norwood, and I have helped loads of patients say goodbye to their back, hip, knee and ankle pain. Hip pain can vary in severity and it can also be caused by multiple factors. So in today's video, I'm going to reveal the key components that underpin hip pain, of which can be corrected, and when they are, hip pain can often dramatically be reduced or even disappear. Okay, so what are these 3 keys to correcting hip pain when running? The first is associated with poor movement patterns and muscle dysfunction surrounding the hip joint. This may be due to a lack of strength and weakness through particular muscles, as well as overactivity and increased firing patterns through others, which change the dynamic and the biomechanics of the hip joint itself. The second is due to poor foot and ankle mechanics or alignment issues. As you can imagine, this not only leads to hip pain, but it can lead to knee pain or foot and ankle pains as well. The third is related to inappropriate footwear. As we've discussed, the hip has a lot of force and impact going through the joint itself. If you have appropriate footwear, that helps to take some of the shock absorption through the shoe, as well as helps to fix your alignment and therefore enhance your running pattern. In other videos to come, I'll go through more detail about how to strengthen and improve muscle firing patterns in running mechanics and therefore reduce associated hip pain. I'll also talk about some key points to consider in prevention to stop the hip pain from coming on in the first place. Sadly, I see way too many patients in the clinic who have suffered from hip pain for years instead of doing anything about it. I've helped many patients say goodbye to their hip pain and improve their running mechanics, and I would love to help you too. Until next time, stay well and we'll see you soon.